All right. Hello, everyone. Welcome back, or welcome if you weren't here yesterday. We'll give it just a minute or two, let people filter in. All right. Looks like we've got a good amount already. So let's just go ahead and get started. Jill and Judy, if you guys are ready.
Mhm.
Um, So good morning or good afternoon, anyone, and depending on where you are in the country. Thanks so much for joining us today, and thank you again if you were here yesterday for coming back. Today is part 2 of 3 of our brain injury training series. I'm Hannah Nixon, Director of Marketing here at TCare, and we're so excited to see everybody joining. I can see a few more people popping in. Again, we have Jill Farrington and Judy Detmer with us today from NASHA, and they are going to talk about supporting clients with brain injury and especially towards those care managers that we have that are in our network and beyond. So as always, feel free to chit chat in the chat there, add questions, comments, whatever you can. Feel free to interact however you please. Jill and Judy, go ahead and take it away.
All right. Hi, everyone. My name is Jill Farrington. I'm with the National Association of State Head Injury Administrators. I'll tell you a little bit more about our organization in just a few minutes. I'm one of 2 presenters for you all today about brain injury and supporting the clients that you serve that you may know or may not know have brain injury. So we did have a shorter session yesterday that was a little bit more caregiver directed, and we are very excited today to be back and to be able to interface with more of you that support caregivers. And so, Judy, would you like to introduce yourself, please?
Sure, thank you, Jill. Hi, everybody. I'm Judy Detmer. I'm Director for Technical Assistance and Special Projects at the National Association of State Head Injury Administrators, NASHA, and pleased to be here with you all today. Thanks for attending.
Great. And I just wanted to mention that we're really grateful for this series to take place. You know, we know TCare works to improve lives of caregivers through the support that you all provide, the strategies that you offer to help individuals lower their burnout and manage stress. We work also to improve the lives of people, most specifically with brain injury, through some of the system work that we do across the nation. So clearly our work overlaps, and we're very happy for this partnership with TCare and this opportunity to bring some information for you all today and to get your questions and to hear your scenarios that you would really like to bring forward when we get to that part of the session. So on the next slide, we thought that it would be useful for us to hear a little bit about you all. And so if you might just take a second and put in the chat your name, the role that you play in the organization or outside the organization, whatever is the most fitting for your role, and then what are you hoping to get out of today's session? So just take a minute or so to put that in the chat, and then know that we'll be definitely monitoring the chat for questions as they come along, but we'll also take some time to specifically open up the floor and address those areas that you would like to dig in more on. So on the next slide, a little bit more, like as I mentioned, about the National Association of State Head Injury Administrators. We're a nonprofit at the national level, and we work to support state government leaders and their partners to promote systems that better meet the needs of people with brain injury, as well as their families, as I mentioned before. And on the next slide, I'll tell you a little bit more about how we do that. There's a lot of our focus is on resource development to share across the country. We see ourselves as a convener of, good practices in a lot of ways. So we try to bundle up important information and put it out there for broad use. We do a variety of training and professional developments. Just a couple weeks ago, we were up in Portland, Maine, with some of your colleagues from TCare at our National State of the States Conference. We do that again annually, and next year we'll be in Little Rock in August, and we bring together many people from around the country that are working in this similar space of capacity building and infrastructure strengthening for people with brain injury and the systems that support them. We work to bring different partners together to do more specific, targeted advancements. We definitely take a hold of state and national trends and make sure that that's being disseminated regularly. And we're very involved with advocacy, particularly at the state level, so that we see the services and supports for people with brain injury not only stay kind of sustainable and level funded, but ideally grow and get more comprehensive as the years go on. On the next slide, we'd like to talk a little bit more about what we hope to do today, and that's these three sort of broad objectives to deepen the understanding of brain injury and talk about the chronicity of it. We hit on that a little bit yesterday, and we'll be returning to that theme. We'll be talking about recognizing and screening for symptoms. You all are in such a important place for potentially having a conversation with somebody after a time that brain injury may have occurred. And so we hope some of the information today gets tucked away in your toolbox and you can tap into it. We want to also talk about the brain injury considerations when it comes to care planning. On the next slide, we'd just like to spend a moment talking and leveling out the understanding of why we feel this is so important, brain injury, and how it's relevant in care management. When we better understand this topic, we are sometimes better able to recognize subtle symptoms that might be experienced by families that might trigger you to ask some questions that help uncover potentially brain injury when it's occurred, especially through recognition of symptoms that the caregivers may be seeing. This topic is helpful in understanding how brain injury can certainly result in permanent changes, and oftentimes they also just result in temporary changes. So being able to understand brain injury can help potentially distinguish that to some degree. We want to break down some of the complexity and talk about how brain injury affects individuals from a physical, cognitive, and emotional well-being perspective, and ways to provide effective and empathetic support. I think I'm going to stop there with sort of that overview. I think we all recognize that brain injury is prevalent in ways and numbers that we sometimes didn't know in our work, and you likely see signs of this across your caseloads and for the people that are being served through the caregivers you support. So with that, I think I'm going to turn over to Judy to take us into our topic.
Great, thank you, Jill. And for those of you who joined us yesterday, you'll see a couple of repeat slides, but we feel it's important that everybody kind of have this fundamental knowledge and framework that we are using as we talk about brain injury. So when we think about brain injury, oftentimes people think about traumatic brain injury, but in fact, there are different mechanisms of brain injury that are not just related to an external blow to the head, which is what traumatic brain injury is. And part of the reason for that is that most of the data that we see related to brain injury is traumatic causes of brain injury. That's kind of what the focus has been nationally since brain injury became kind of a disability category. However, in practice, most states and most resources now are addressing both traumatic and non-traumatic brain injury. So non-traumatic is looking at that internal event, something like a stroke or tumor or lack of oxygen to the brain, some type of infection. And so when you think about people that you're supporting or the people who are supporting the people, just think broadly about brain injury, because regardless of if it's a traumatic cause or a non-traumatic cause, oftentimes when someone's living with a brain injury, the strategies and supports will work for either. So all of this is relevant regardless of that mechanism of injury. So the term that is often used as an umbrella term is acquired brain injury. So if you've heard that, that is meant to indicate either a traumatic or non-traumatic This is just something that the field even gets kind of confused on, so we thought we should bring to your attention. The other thing that we wanted, Jill kind of talked about this, the prevalence of brain injury, but just bringing that to life with some numbers. When we think about brain injury, oftentimes, it's beyond people who are hospitalized with brain injury. Those rates are specific to they had to stay in the hospital for up to 24 hours. But when we're thinking about supporting people with brain injury, we want you to think about beyond those who are hospitalized to those who may have had multiple brain injuries and not ever been diagnosed or seen in a hospital or emergency room that way. So there have been surveys and efforts done across the country, specifically out of the Centers for Disease Control, to think about what is the prevalence of brain injury versus just the incidence of brain injury. And what we found is that about 20 to 30%, when surveyed, just randomly surveyed, 20 to 30% of adults will endorse a history of brain injury. And that's self-report, but some kind of lifetime exposure to brain injury. And for children, it's around 10% that will have experience of a brain injury or concussion based on and it varies based on the survey methodology. People age 75 and older have the highest rates of brain injury. So if you're working in that area and working with aging family members or clients, that's the highest rate of brain injury that we see, and we'll talk about why, but it's related to falls. Males are 2 times as likely to have a brain injury in their lifetime than females. And then when we think about falling, because falls are actually the number 1 cause of brain injury, we see that about 1 in 4 older adults will have a fall annually. And so not all of those are going to lead to concussion or brain injury, but they certainly could have that effect. So just kind of keeping that in mind and thinking about brain injury, as we said, as a chronic condition. A lot of people with one uncomplicated concussion will resolve completely. Others who've had multiple concussions will maybe experience lifelong chronic brain injury. And sometimes even with a single concussion, if there was a bleed or a hematoma or some other medical event that accompanied it, you can see lifelong problems. So I mentioned causes and falls being the number 1 cause of brain injury nationally. So what we see are falls, accidents, and accidents meaning car accidents, maybe cycling accidents, being a pedestrian and getting struck by a car. And then for non-traumatic, we're looking at stroke as a number 1 cause. And then assaults, again, going back to traumatic, is a high contributor to brain injury. And again, thinking about mechanisms of injury, people who have experienced near drowning could experience a lack of oxygen. People who have experienced intimate partner violence and strangulation, there could be a lack of oxygen, or for whatever reason, lack of oxygen to the brain is another pretty high cause. So some of those risk factors, not everybody recovers the same. And unfortunately, the more risk factors we have, the more likely we are to sustain kind of a chronic long-term injury. And some of those are age and frailty related comorbidities. We see that our aging population does not recover as fully as a younger population. The complication of medication use. So if someone's using medications and then sustains a brain injury, that can kind of compound the recovery of brain injury. Also, medication use can lead to brain injury because of falls and being unsteady or being drowsy, those kind of things. Substance use and brain injury go hand in hand. So if someone is using or abusing substances, oftentimes we see poor outcomes if they sustain a brain injury. And oftentimes it's that chicken and egg, is the substance use causing the brain injury, which people who use substance sometimes will take greater risks, and we see greater falls or accidents, things like that, leading to brain injury. So because you won't always know somebody had a brain injury, they may not come to you with a medical diagnosis of brain injury. It is important to recognize some signs and symptoms of what brain injury can look like. And what we see, we break this down into these 3 buckets of physical, emotional, and cognitive. And so thinking about physical, especially immediately after a brain injury or a concussion, people can have headaches, dizziness, some balance issues, but that can also persist into a chronic condition. For emotional, we see increased irritability. Oftentimes, depression and anxiety will accompany brain injury, some mood swings. And this is one thing I just want to stress here is that what we're talking about here is a change from what they were before the injury happened. Some people may have already had some of these issues. And if that's the case, brain injury might serve to expand those issues, unfortunately, for somebody. Thinking about cognitive, we're talking about short-term memory loss, maybe poor judgment, organization, some of those things that you might see. And then just thinking through other red flags. I mean, I think the number one thing to tune into is if you're working with somebody or, guiding someone, has there been a change? Talked a little bit about this yesterday, but unfortunately, we know that people don't always disclose if they've fallen or maybe sustained a concussion, especially if they didn't lose consciousness. Maybe they were dazed or confused because they are afraid of disclosing that and having some of their independence maybe reeled back a little bit. And so one thing that we really stress is just if you see a change in behavior, a change in any of these areas up here, to really tune into that and maybe seek some support. We'll talk about that a little bit more. The other challenge with brain injury is differentiating brain injury from other conditions. And we hear this quite a bit, and it is true. It's very challenging to say, is this brain injury related? Is this mental health related? And in our aging population, is this maybe dementia or some kind of aging condition versus brain injury? A couple of things there. One is when we talk about supporting someone with brain injury, it's less important to know what's causing some of the challenges the person has, although it's still kind of helpful to know that, but it's less important. You really just want to be addressing the challenge. But when we talk about medically, it is important to understand if it's a brain injury or dementia specifically, because dementia, of course, people are declining when they have dementia. With brain injury, they're going to plateau, and so your treatment could look very different. Their supports could look very different. And so we'll talk a little bit about assessment and evaluation. And I say all that to say it's often very challenging to sort out what is what. With behavioral health, we like to have people screen for brain injury if they're seeking behavioral health services because it helps you think about how to support a person and thinking about accommodating those deficits that go with brain injury. So I put this on here to say it's challenging. We definitely recognize that. And hopefully some of the strategies that we talk about and some of the ways to approach this, it won't necessarily matter as much as just knowing how to address the challenges. So let's move into that a little bit. Care planning strategies. One thing to think about is there's prevention strategies, and I think that's really important when we're talking about caregiving, whether it's someone who's aging, someone with a disability, whatever the circumstance is as to why they have a caregiver. Things that we could do to help prevent brain injury in the first place are to really think about the environment. How is the environment set up? Are there tripping hazards, fall hazards? Because again, falls are a big contributor to brain injury. How is the lighting? All of those environmental factors are important to consider when we think about how to support someone with brain injury and prevent brain injury in the first place. The other thing to mention here is that when someone has one brain injury, their likelihood of sustaining a second one goes up exponentially. So we want to also prevent secondary brain injury. So if you're aware of someone who's had a brain injury, these things are even more important to think about. So that's a little bit about prevention. On another note about environment, setting up the environment to be conducive for someone with a brain injury, such as keeping the space quiet, limiting distractions, helping them to be able to focus and concentrate, will help you be able to implement strategies more successfully as well. But other things that we can look at are communication tips. So being very clear in your instruction, remaining calm, and repeating instructions as much as possible. Again, if you're dealing with a couple of things, someone might not be able to process the information that you are giving to them, instructions that you're giving to them because of a delay in speed of processing. So being able to slow down how you give those instructions, giving instructions one at a time, repeating those instructions, that's all going to help both with processing and short-term memory loss, which often accompanies brain injury. The other thing is to have structured routines, and that can help reduce confusion or the need for relying on that short-term memory. Once something is in routine, that becomes working memory, long-term memory, and a person is able to access that. But when they're learning a new routine, it can be very challenging. So you probably see that if you have been a caregiver anyway, that routines are important for a lot of people to help kind of reduce any confusion, but also to help cognitively reduce that cognitive load of having to think about what am I doing next. That having a routine helps reduce that cognitive load. The last thing here is pacing activities. And so being very mindful when someone is becoming fatigued. And I mentioned yesterday that fatigue is definitely a common characteristic following brain injury. No matter how significant the brain injury was, fatigue is almost always something that someone is going to be addressing following brain injury. And if we don't build in rest or pay attention to that, then what happens is that the person can become kind of overstimulated and overwhelmed. And then you might see some outburst type behavior because they're just trying to get everything to stop. And so kind of tuning in if you see someone getting fatigued, and that might look like irritability, it might look like fidgety, it might literally look like they're tired, and just make sure to build in some rest breaks so that they can be fresh with any kind of new instruction or activity. When we think about caregiver education integration, and so obviously some of you are caregivers, some of you are training caregivers, some of you are case managers. I see main thing is getting that general education about brain injury, but then for the person, having them be actively participating in rehabilitation with brain injury, creating that structured environment and prioritizing caregiver well-being. You guys always hear this, but if you're not in a good place to take care of somebody, that's going to make it even harder. So obviously, as a caregiver, we need to do some self-care related to that. But thinking about how to integrate the person with a brain injury in some of this planning so that they have buy-in, but it also helps them really implement strategies much more easily. I did want to touch on can't versus won't. Again, apologies to those of you who were here yesterday, but again, I think repeating this information is actually helpful if you're just being exposed to it for the first time. And for those of you who are joining us for the first time, this is an important component to brain injury. As you see our friend here, the T-Rex, there's no way he could lift those curtains beyond where they are. It's not his fault. He has very short arms. That's just the reality of being a T-Rex. Unfortunately, with brain injury, you don't see what their deficits are because oftentimes it's cognitive, it might be executive function related deficits. And so what happens is it gets attributed that the person has a behavior problem. Now, you would not blame Mr. T-Rex here for not being able to put those curtains up higher because you can physically see that he can't. But we do get into this kind of conflict with people with brain injury sometimes, trying to figure out, is it willful behavior or is this a skill deficit? And so in that regard, what we really challenge people to do is kind of use a different lens and think first, it could be a skill deficit versus first, it's willful behavior. And so taking a step back, seeing what the behavior is and thinking about, do they have the skill to actually do this task? Do they have the memory capability? Do they have the organizational capability? If not, let's teach them how to do some of this. And so we always like to touch on this because we want to challenge people to think beyond kind of that reflex of it's a behavior issue. So when thinking about brain injury, I want to talk about this in both kind of an acute phase and also long term. But if you're working with someone and you see, maybe you've witnessed them hit their head from a fall or some other way, what you want to watch for in that first bit of management is to think about are symptoms worsening. We always recommend that people go to seek medical support. I'm just going to talk about my aunt for a second, who is stubborn as all get out, and I come by it very naturally, so I'm proud of that. But she was very prone to falls, and every time it was such a fight with her to get her to go see medical help. And again, I understand, because she was afraid that, she wouldn't be able to live independently and things like that. But you want to rule out things like a bleed or a hematoma. And so let's say the person wins and they don't go to the medical setting. What you want to watch for as a caregiver is, are those symptoms worsening? Because typically, if you have a concussion, you're going to have some acute symptoms, maybe headaches, maybe dizziness, maybe nauseousness. But those should resolve over time in a 24-hour period or so. They're going to start resolving or reducing or go away altogether. If they start to worsen, that's maybe indicating a bleed or a hematoma or some other structural damage that was caused by the fall, and definitely immediate medical support is needed. The other thing to watch, like I said before, if there's sudden changes in behavior, maybe someone then did experience a fall and you don't know about it, or it's just hit their head and you're not aware of it. And you can start thinking, is the sudden change of behavior maybe related to a concussion or brain injury? Anytime someone loses consciousness, definitely it's a good idea to get medical support. Even if they didn't lose consciousness, you do not have to lose consciousness to sustain a concussion. If you don't lose consciousness and you're still kind of spacey, or you have an altered mental status, those are still good times to seek additional support. And then as we think about people living with brain injury, this speaks to the chronic nature that we're understanding about brain injury now. It used to be thought that people with brain injury, it was like a static thing. They would really recover well, or most of the recovery happened that first year to 2 years, and then they would plateau. And it was thought that's who they are, then, that plateaued level. Unfortunately, what we realize now over the years, and with some good research, is that what we see is that people start to decline while they age with brain injury, and they develop new conditions, or other conditions worsen. And so we just have to kind of keep an eye on, where are they at? Are they declining? Is there something going on? And if they are, they could be seeking support to help bolster whatever's declining. It could be a medical issue. It could be cognition. It could be other things. And any of those you could seek some support for. Okay, I want to switch gears here and talk a little bit about screening and support. We've been talking about support, but I want to talk about screening. Because as I mentioned, oftentimes if people have had multiple mild brain injuries, multiple concussions, they may not even be attributing some of the deficits they're experiencing or challenges they're experiencing to those multiple injuries. So you may not be aware that someone has a brain injury. So we really stress screening for brain injury to help kind of uncover those past injuries and see if that's part of why a person's struggling. And then we can talk a little bit about how to support them more. So I've been in brain injury for 34 years, and I've gotten into different, I'll call them discussions, maybe arguments, with people that if the brain injury is bad enough, they will seek medical support. That is not always the case. And this research, this is older now, it's 2007, but 42% of people indicated that even though they had a brain injury as defined by the Centers for Disease Control, they did not seek medical attention. There are so many reasons why someone may not seek medical attention. There may be insurance issues. There may be legal status. There may be, just like I said, fear that if they disclose they hit their head, that they'll lose some independence. Whatever the reason, a lot of times people with a brain injury that doesn't result in loss of consciousness, but maybe altered mental status, getting your bell rung, seeing stars, that kind of thing, may not seek medical attention. So they may not be aware that brain injury is part of what they're dealing with. And the reason it matters, it helps us think about what are their current emotional and cognitive statuses, and then particularly behavior associated with executive functions. So that's the frontal lobe of your brain, or your executive function, your hard drive. That's all about judgment, reasoning, organization, impulse control, all those things that really, if impaired, make living life independently very challenging. So it can help drive how we support and care for somebody. And we know that brain injury can lead to greater risk problems and factors. So I think it's just our behaviors. So it's important to kind of identify if brain injury has been part of someone's history to give them the support necessary and keep them safe. So screening can vary from pretty elaborate to pretty simple. One thing I will say is asking a singular question about brain injury has found not to be very helpful. So we meet with a variety of systems, and sometimes they'll say, well, we have a question on our intake, and it might be, have you ever had a traumatic brain injury? Have you ever had a brain injury? People oftentimes, again, will not identify as having had a brain injury unless they've had a brain injury that was severe enough to land them in the hospital. They may not even be thinking about brain injury. And so what has been suggested and been researched to be effective is to ask this question in lay people's terms and in a variety of ways. And so for this specifically, some places will use this as what they call a pre-screen. Others will just use it as a way to identify brain injury. But what we want to do is elicit responses. So the first piece here that you can see is thinking about your injuries. Have you had, thinking about injuries you have had in your lifetime, were you ever knocked out, or did you lose consciousness? Loss of consciousness is not, as I said before, necessary to say that you had a brain injury, but it is indicative of outcome. And so if someone's lost consciousness, their chances for long-term effects are greater than if they didn't. So you want to know that. And then, have you ever lost consciousness from drug overdose or being strangled or choked? And that's what I was mentioning earlier about lack of oxygen to the brain. One thing that we're finding now is in correspondence with the opioid crisis is that people who overdose will lose oxygen to the brain and may sustain long-term cognitive decline from that lack of oxygen. They can be out for a long time sometimes before they're revived. And the other thing that happens is they may lose consciousness and fall and hit their head. And then for people who've experienced intimate partner violence, we see a high correlation between strangulation and being choked with lack of oxygen and brain injury as a result. And then the final one, have you ever been told by a doctor or other health professional that you've had a medical condition that affects your brain? So just getting people to think about brain injury in a different way. So that's a pretty informal way of screening. There are several screening tools, and this may be beyond what you're going to implement or need, but we wanted you to have some situational awareness of this. There are screening tools that have been validated and are found reliable to identify history of brain injury. I want to make really clear that none of this is diagnostic. The 3 screening questions, even these more elaborate screening tools, they are not diagnostic tools to help diagnose brain injury. They're simply to help you gain information and put together pieces of the puzzle to see if brain injury could be interfering with why a person's struggling. And so the OSU TBID, the first one up in the left corner, that is really the one that we find being used most consistently across settings across the country. It's a pretty brief interview, just meant to elicit a history of brain injury. Can be administered by non-brain injury professionals. All these can be administered by non-brain injury professionals. The brain injury screening questionnaire is another tool. It's much more extensive in terms of number of items, and there is a cost for it, but it's an excellent tool also for identifying history or lifetime history of brain injury. I saw somebody in the chat put something about youth and child welfare, so I'm glad that you're here. The Brain Check survey is a great instrument for youth. So school-age children specifically. It was normed on a population of 5 to 21. It is also a brief measure, but goes into a little bit more detail beyond just looking at lifetime exposure and gets into questions about how a person's functioning currently. And then finally, the traumatic brain injury questionnaire is another tool that sites have used. All have very similar approaches of trying to ask those questions in lay people's terms in a way that people can recognize and understand to build that picture of if brain injury is part of the issue. The last tool I want to mention is the online brain injury screening and support system. This is a tool that we developed at NASHA. It takes the best of the best, basically. It takes the OSU TBID. It is meant for 13 and older. So those are you working with the young kids. This would not be practical for you. But for those working older populations or anybody 13 or older, this could be a feasible instrument. And it combines the OSU TBID. So we look for that lifetime exposure to brain injury. If someone has experienced a lifetime exposure, they are prompted to go on and do a symptoms questionnaire to look at current functioning, current challenges they may be having. And the beauty of this tool is that it answers some of the so what, now what. So oftentimes when we talk about screening, that's the question people have. Okay, great, I identified them. Now what do I do? So that's what this tool is meant to do. Let's talk about the so what, now what, because a lot of times people hear brain injury and it kind of scares them because they think of brain injury as a medical condition, a medical event, and maybe that they don't feel equipped to support. But in fact, really, brain injury is about those individual challenges that someone's experiencing. It's less about, medical treatment has happened. Now that ship has sailed. We're moving into living with brain injury. And so our kind of messaging here is that we're not talking to people about treating brain injury. We're just talking to people about compensating for the challenges that they have and keeping that in mind if they're doing mental health treatment or care coordination or other supports for people with brain injury, thinking about what are the challenges, how do we develop compensatory strategies to support them, and really demystifying that for professionals. Ultimately, it helps empower the person with a brain injury as well to understand this and families so that people can advocate for what they need. I want to touch on evaluation and assessment considerations. So if you suspect someone has had a brain injury, there's a few things you can do. One is, again, if it's an immediate issue going on, you want to get them to medical support. Take them to their primary care. Take them to the ER if you're seeing some pretty significant issues. So there is a medical component of support. Beyond that, when we're trying to figure out how is the person being challenged by their brain injury, we can start looking at other resources. Cognitive evaluations can be very helpful. So looking at those things like memory, processing, reasoning, some cognitive evaluations can help sort that out for you and provide some tips and strategies. The gold standard related to brain injury is neuropsychological assessment or evaluation. And so I think if you're dealing with someone who you're wondering, is it dementia? Is it brain injury? What is this? And you want to get a little bit more clear on that differential diagnosis, a neuropsych eval is going to be necessary. The challenge is finding a neuropsychologist and getting it paid for. So you have to really advocate on behalf of the person for why they need that evaluation. Most of the people, if you want to look at kind of intervention or screening in a triangle, most people, you'll just have to do that lifetime history screen and it gives you some strategies and thinking about how to work with the person. But if they're still struggling, that's when you want to start elevating into these more formal evaluations. And I would start with a cognitive evaluation before going to a full neuropsych eval for most people. Again, if there's a question of dementia and aging, we might want to jump right to a neuropsych eval. That's a lot in a short period. Happy to talk more about it. You can always email me if you have questions. The other resource that's out there for you is brain injury resource facilitation. I see a lot of case managers on this call, and that's very exciting. And I saw someone use the term resource facilitation in their introduction. in brain injury, we are working hard at a national level to try to have resource facilitation available across the country. We're not there yet. You can see on this map, the pink color are those who provide resource facilitation, which, to put it in perspective, is really kind of doing some case planning, follow along, helping them to get resources that they need. It falls short in intensity compared to what we would consider case management, but it is more intensive than like information and referral, which are the blue states. But information and referral can be very helpful to get you on the right path to getting to the right resource. And then for those green states, there's not anything that we have determined there. If someone's from one of those states and know of something, please let us know. But there's not any kind of formalized information and referral or resource facilitation network. But if you go to the Brain Injury Association of America, you will get to their information line, and they are going to be able to help you get some resources. So every state has something, well, not every state, most states have something in place to help guide you if you have someone you think has a brain injury. And then lastly, so we make sure to leave some good time for questions, we wanted to leave you with a few resources. So I mentioned the Brain Injury Association of America and the locator of brain injury associations by state. That is such a good resource. So if you click on that link, you'll find the map, you'll see your state, you'll be able to click on it. It'll get you to the right people within your own state. There's also caregiver information center, so very pertinent to what the work you all are doing. And then at NASHA, we have a state directory of resources. We include also the brain injury associations, but we also have what we call the lead state agency on brain injury, which can be very helpful in terms of thinking through how to connect with Medicaid or other kind of state or public services and to resource facilitation. There are some specific supports offered in Spanish, and that's the third link that you could look at. So if you're working with someone or if you yourself know of a family member who's Spanish speaking, that could be a great resource. And then the Model Systems Knowledge Translation Center has a bunch of fact sheets. I mean, a lot of fact sheets. So model systems are brain injury model systems that do research on the care and treatment of brain injury, and they produce these fact sheets that are written in kind of lay people's terms, meant for caregivers, meant for people with brain injuries, family members. So that might be a great resource. And then finally, we at NASHA developed this aging guide, so helping people think about what's important as people age with brain injury, what kind of supports, what kind of, when we're thinking about medications, when we're thinking about therapies, any kind of intervention or support, what's going to be important. So hopefully all those will be of help to you. And with that, I'm going to stop sharing, and we would love to entertain any questions that you have.
And Judy, while we're looking for questions from this group, there was a thing or two in the chat I wanted to bring up for you. One is Kathleen from Michigan. She was looking at the interest of knowing, how do I get hospitals to connect with, say, her or her organization so that she can reach TBI caregivers early in their journey?
That's such a good question. Kathleen, while we're talking, I will try to do this and see if I'm successful. There is a Brain Injury Association of Michigan, and Nicole Shotwell is the executive director there. I would recommend reaching out to her maybe as a starting point if you don't know her already. I think that they are doing some work trying to educate hospital systems about their work. So I think you guys could partner on doing that. The other thing I would just say, and probably something you've already done, is getting together with those kind of, not every hospital has a social worker anymore, but that kind of person, a discharge planner, social worker, just educating them. But I think connecting to the Brain Injury Association could be very helpful.
Mm. The other thing, Judy, is you mentioned it earlier, the support that might be, or the aspects of this topic that might be unique to youth and children. So we talked a little bit about the Brain Steps, I'm sorry, the Brain Check survey, which is no cost and, easy to get online and use. Other considerations when it comes to supporting children and youth, I think, for me, I'm wondering if you might chat just a little bit about even the kind of working with the schools when we're identifying youth with brain injury and their needs.
Yeah, I'm so glad to see you. And we are looking some at child welfare system and kind of those systems that work with kids with complex needs. But in terms of schools, I will say that there's not every state has all the resources that some other states have. But what we really encourage is doing some education with those school personnel to understand brain injury and understand how to recognize, kind of screen for brain injury, as we've been talking about. I am also going to put in the chat a link to the Colorado Department of Education. They have a really comprehensive website that has a manual for educators. It has how to do assessment for youth with brain injury. So if you suspect attention problem, here are some of the assessments you can give that school psychologists and school staff can give. And then what are some of the interventions? So it really is, the schools are so primary in terms of children and youth, obviously, since that's where they spend the bulk of their day, that's where we try to focus our energy. But the other areas are really working with behavioral health systems to understand and recognize brain injury in youth, because that is not something typically on their radar. So it comes down to that kind of capacity building rate, raising awareness about that brain injury could be something someone's struggling with, and then giving them these kind of resources for how to make those compensatory strategies. And one word about compensatory strategies. We are talking about pretty simple strategies that anybody can implement pretty much in any environment. So again, not treatment of brain injury, but thinking about if I'm working with a kiddo who struggles with organization, what can I do to help bolster organizational skills? Teach them how to use their phone as a planner, teach them or give them reminders that their homework is due, make sure that there's good communication between home and school. Those kind of things. Where we get into a struggle sometimes with youth is as they reach certain developmental ages, there starts to become this kind of conflict about, well, they should be able to do that on their own now. They should be doing that on their own. But I'm going to go back to our friend T-Rex because, and I'll actually use a better analogy, and that is if you had a youth who was a teenager who used a wheelchair, developmentally, they should be able to walk, but obviously they have a disability, they have a medical condition, they have something going on that's preventing them from walking. So when we talk about kids with brain injury, we get in this argument about we're not going to give them those reminders. They should be doing that for themselves now. They should be using their executive functions, but they can't. They cannot do it because it's a skill deficit. So it's some of that understanding. I'm kind of rambling there. Kids are my passion. So I'll put in the website, the website for you, or in the link, the website for you.
Great. Just double checking with Hannah, I don't see anything that's come through the Q&A. Is that how you see it on your end too? And I've just been watching for.
Yeah, I don't see any, scrolling a little bit in the chat, I don't see any questions or comments right now. I did just put in the chat our part 3 of this webinar series on December 4th. So don't forget to sign up for that before you go today. That one is Caring for Veterans with Brain Injury, Practical Approaches for Families. We will be sending a follow-up email also with all of the resources, recordings, next webinar, things like that in there. So we'll just maybe give a minute or so. If you have any questions or comments, please feel free to put those in the chat. And if not, we can just give you back some time today.
I'm putting in a couple of resources here for the children. I know you all will get these slides, you'll get our contact information. So as you kind of walk away and digest some of the information, if something comes up, feel free to reach out to Jill or I, and we will do our best to answer any questions or get you connected to any resources that could be helpful.
Yeah, I love that you said that, Judy, because with the Michigan example, we can always do an intro with any of you and your state leads around brain injury. And when we say leads, oftentimes those are state positions that are serving as a kind of key point of contact around the topic of brain injury within the state system. But we can also make connections like the Michigan example to our more community-based advocacy and association contacts. So we definitely welcome you to get in touch.
Awesome. Thank you. Well, I guess if that's it, I guess we can give you guys some time today. Maybe you can start your Fridays and your weekends a little bit early. Thank you so much, Jill and Judy. Again, it was so great to hear from you guys, and we're excited for our final part. It won't be the final time that we do collaboration with you, but final for this series. So like I said, a follow-up email will be coming out soon, probably later this afternoon. And if that's it, we'll see you guys next time and have a great weekend.
Thanks, everyone.
Thanks, everyone.
Thank you.